So there is that kind of bell curve we think of, like how do we optimize our nervousness to be successful? And I also think there is this feeling, and I think there's a culture of immediate gratification. You know, I feel something, I don't want to feel that thing. I want something, I can get it right away. There's not this feeling of it's okay to sit with some uncomfortable feelings, because that's just part of life, right? Like that's just normal human development. Things aren't always comfortable, things aren't always happy. And sometimes in those times of discomfort is when we really grow the most, when we put ourselves in situations where we are not comfortable, it doesn't come naturally to us. People talk about this all the time with public speaking, talking on a podcast, doing things that might be out of their comfort zone. But with those situations, every time you put yourself into those situations, you grow more and then you become more comfortable, and that can kind of permeate through other areas of your life.
Welcome to the Real GI Doc Show. I am your host, Dr. Fred Gandolfo, and I'm a gastroenterologist with a medical practice here in Long Island, New York. Today's episode, I am happy to announce that I have my special guest, Noreen Vail Gandolfo, PhD, back in the house with me today. And today we're going to be talking about a special topic that is not entirely related to gastroenterology. It's more general than that, but it's much more interesting than the normal stuff that I talk about. If you have not heard Dr. Noreen Vail Gandolfo speak before, she was my first guest on a prior episode, which I'll link below. And what did we talk about on that episode?
We were talking about
how to make healthy habits, perhaps?
How to kind of facilitate change.
That's what it was.
How to motivate people.
Does that seem like it was like 10 years ago?
That feels like it was a lifetime ago.
It does. It absolutely does. But not only is Dr. Vail my wife, but she also has a PhD in clinical and school psychology. Mm-hmm. And what did she do? She graduated from Hofstra University.
Yes.
With her combined PhD and something else.
That's correct.
What else did you get there?
I had a master's in school psychology, and then I graduated with a PhD in clinical and school psychology.
Excellent.
I'm licensed in New York State.
She is a licensed psychologist.
Yes.
But I should also say that this episode is not medical advice or psychological advice, but more just general information for you. So there's the disclaimer. And we're going to talk, it's a continuation today about an episode that we did in the past that Dr. Vail was not present on, unfortunately. But this is episode 27 that I'm going to talk about today. It's from a patient, or actually not a patient of somebody, not my patient, a man named David from California. And David wrote us a nice email, and it went into anxiety, and that's why I'm bringing it up today with our special guest. So David wrote, I watched your videos on YouTube and they're very helpful. However, I'm just not able to keep the prep fluids down, and this is in reference to doing a colonoscopy. I have very severe anxiety in general and nausea and vomiting related to that. The more my doctors say I just need to do it or I just need to relax, the more stressful and difficult it becomes. I have failed 4 times now. My question is whether there is such a thing as an IV option for prep fluids. Does this option exist? How would it be done? I asked my doctor and he's never heard of such a thing. His only advice is to stop being anxious and just not throw up, which if you knew me and my anxiety, that would be as unreasonable as telling a person with colon cancer just to not have cancer. I know from experience that I would be able to tolerate IV, meaning intravenous, if the option existed. I also tried the tablets, but I have trouble with pills that are not small and just could not swallow a single one. I really want to get a colonoscopy, especially since my grandfather died of colon cancer. Signed, David. And I covered my advice for David in episode 27. And basically my advice was similar to his doctor's advice because I'm a terrible psychologist. And I basically just said, stop worrying about it and just drink the prep. And if you can't drink the prep, take the pills. And if you can't take the pills, do a Cologuard test. A Cologuard test is a non-invasive test, not as good as colonoscopy, but much better than doing nothing. And I've covered this a million times on the podcast. I'm not going to go into the specifics of that now. So I'll link to this episode early if you want to hear my amazingly bad advice on episode 27. So David wrote back to me, actually. And again, I've never met David, but he's a pretty cool guy for staying in touch. And he wrote, "Thank you, Dr. Gandolfo. That was very helpful. I will discuss with my gastroenterologist regarding the prep advice I gave him. And he wrote back a couple of things. Fortunately, I have a healthy diet. I exercise regularly. I don't smoke. I drink no alcohol at all. I do see a psychiatrist monthly and a clinical psychologist weekly, and have for well over 2 decades. Unfortunately, my strongest anxiety symptoms revolve around things with eating and flavors. I know it may be difficult for others to understand, but my anxiety really isn't rational, and things that you mentioned are normally major anxiety triggers in people, fortunately, are not for me. I actually lived in a war zone overseas for years and dealt with it much better than the rest of my family. And other common sources of anxiety, such as speaking in front of large audiences, do not impact me. It makes no rational sense, but there are a few seemingly insignificant and obscure areas that cause me a severe amount of anxiety, despite significant amounts of evidence-based treatment, while the normal stuff doesn't impact me at all or very little. The irrationality of it all actually makes it much more frustrating in a way, but it is what it is. What do you consider to be the best tasting, lower volume traditional colonoscopy prep fluid on the market today? The closest I have gotten has been with Clenpic, which I'm open to trying again, but I was wondering if there's anything potentially easier. I know preferences vary by patient, but I'm open to trying them all to see if there's one that I can tolerate. So basically, David came back and just said that he's not anxious in general about everything in the world, but he is anxious about these specific things that affect his colonoscopy prep. And that kind of leads us to today's episode. And basically, David said that which was my advice, was just telling him not to worry. Just don't worry about it. Does that advice ever work? It's kind of like telling someone to calm down when they're agitated. Does that ever work? We all know it does not work. No comment from Dr. Noreen Vail, PhD. So let's follow up with David's situation. And I basically just wanted to turn this over to Dr. Vail and ask you, what is the definition, just taking it back to the basic steps, what is the definition of anxiety?
Well, first of all, I think David is an incredibly self-aware patient. He's gone through all of these steps. He's aware that it's irrational, and I think that's one of the things people have a hard time understanding about anxiety in general, is if you haven't ever experienced it, that it's not rational. It's something that your first instinct to tell someone is, don't worry, because that's something that you may not be worried about or something you don't have a difficult time with. Before we get into the definition of anxiety, I want to say that it does become something that gets thrown around, I think, very frequently. I have anxiety, or, my husband experiences anxiety. And I think we really do have to look at that definition. There really is a research-based diagnostic criteria that we look at. There is a diagnostic and statistical manual of mental disorders, and that's kind of, our handbook, our guidebook that's research-based. It's put out by the American Psychiatric Association, and it does outline for us these clusters of symptoms that we look to kind of determine whether or not someone does have anxiety, and then that helps guide us with various evidence-based treatments, because that's ultimately, at the crux of psychology, it is a science, right? We want to make sure that what we are recommending for people to handle the things that are frustrating them or really significantly impacting them in their life has been shown to be effective, safe, and ultimately going to help them reduce that frustration. So when we think about anxiety, these are the few markers that we look at, right? It's not just a matter of what would be situation specific and what would make anybody feel nervous, right? There's these things that you're worried about more days than not during the week for at least 6 months. So it's something that we look at a time frame for. And it's usually, there are a number of events and things that you become worried about in school, in work, in your social life. So it really is more of a global impact. It's intrusive, so you can't push these thoughts out. You might have racing thoughts. You might have intrusive thoughts that come about when you're doing other activities, and that you can't seem to stop them from impacting your other thoughts. And then there's, some other associated symptoms that happen that some people might attribute to other things because they are more general, but you might have that feeling of restlessness, being on edge, feeling easily fatigued, having a difficult time concentrating, or maybe your mind goes blank and you don't remember what you were thinking or saying, increased irritability. So again, that feeling of being on edge and just kind of having that tenseness to you. You feel it physically. I mean, people will feel that muscle tension because you feel like maybe you're holding your shoulders up really tight, or just in general, your body just feels very stiff and tight. And then also sleep disturbances. So that could be difficulty falling asleep, difficulty staying asleep, waking up frequently throughout the night, and again, probably coupled with some of those intrusive racing thoughts. And then we also have to look at the impact. So, is it significantly causing distress? There are some people who might be saying yes to all of these things, but they are functioning. They're waking up, they're going to their job, they are caring for their children and their family, they are out socializing with their friends. And so it's really not impacting them other than how they're feeling internally. Externally, they're still functioning, going about their day. For real significant impact, you're saying, like, I can't make it to work, I'm not socializing with my friends. When these things come up, like, it's really preventing me from engaging in activities that would really help my well-being. So those are just some of the, the key criteria that we look at. And then, of course, we want to make sure that there's no other possible causes for this. Are there any other medical conditions that might be mimicking these symptoms? Are there any comorbid conditions? Does the person have a history of panic attacks, separation anxiety, specific phobias? Are there more specific, or is it a more general feeling of just, fear or worry about a number of topics?
So thank you for the definition, because I think people throw the term around, like you said, and, my anxiety is kicking in or whatever it is. And I don't know, I always feel like some degree of anxiety is probably useful. It probably didn't come from nowhere, like in terms of evolution. It's probably nice to be, or it's probably like a warning sign or whatever it is, or like say, hey, pay attention to this. Like there's something going on that you should be aware of. And maybe that's why anxiety exists. If we just went through life just kind of aloof and didn't care, like bad stuff would happen, I feel like. And, in the modern age, that's all is the information you need to know to stay safe and stay alive. And back in the day, maybe it was that you had to be anxious that there was a tribe of hostile people in your neighborhood, or an animal that was, lurking in the bushes to kill you. And that was the anxiety. Right. But yeah, it seems like everyone's anxious. And it might be true, because now that you're saying the definition, I don't really consider myself very anxious, but now I'm like, wait a minute, I do some of those things, those intrusive thoughts, and all these kind of, some irritability sometimes when I can't get my work done or whatever it is. And so sure, maybe I'm anxious about those things. But why does it seem that everyone is it just trendy to be anxious now, or is everyone just really anxious now? Is the question. I don't know if that's a real question or not, but.
No, I think people are always looking for, something to kind of explain the way they're feeling. And I think you hit on a good point. There is a certain amount of worry or nervousness that is normal, and that without, we wouldn't be activated to do things. If you don't have enough of that, you don't do anything, right? So you won't get out of bed, you're not motivated. If you're too anxious on the other end of that spectrum, it's paralyzing, and you also don't act. So there is an optimal level of, worry or nervousness that would cause you to do things. You have a big test coming up. Well, you're going to study, and that's going to, it's going to motivate you to study, which in turn will, hopefully you will do well on that test, and it will kind of perpetuate that cycle. But on either end of that spectrum, it can definitely impact. So there is that kind of bell curve we think of, like, how do we optimize our nervousness to be successful? And I also think there is this feeling, and I think there's a culture of immediate gratification. I feel something, I don't want to feel that thing. I want something, I can get it right away. There's not this feeling of it's okay to sit with some uncomfortable feelings, because that's just part of life, right? Like, that's just normal human development. Things aren't always comfortable, things aren't always happy. And sometimes in those times of discomfort is when we really grow the most, when we put ourselves in situations where we are not comfortable, it doesn't come naturally to us. People talk about this all the time with public speaking, talking on a podcast, doing things that might be out of their comfort zone. But with those situations, every time you put yourself into those situations, you grow more and then you become more comfortable, and that can kind of permeate through other areas of your life. So there is definitely that optimal level. I think people have, the way we receive information now is in sound bites. So sometimes people hear a term or a key phrase and they kind of hold on to that and they think, oh, well, I've experienced that too. I must have that, right? Like, just like you were saying, oh, I'm irritable sometimes. That must mean I have anxiety. Well, no, probably not. You probably are just experiencing a normal amount of worry. And again, situation specific. If somebody is being, seen in your office and given some very difficult news and they have a very strong reaction to that, that's not because they have anxiety. That's because that's a normal reaction that most people would probably have to hearing very difficult news. So I think there's understanding what's part of the human experience and what is more extreme to that and what does not, kind of fit in with that. And the access to information. We talk about this all the time. You can find any information to kind of support your thought about something.
That is true. That is true. You don't want to find yourself in the cult of anxiety.
No.
But yes, it is probably normal to have some anxiety. And when it becomes too much, I think that's probably what you touched on earlier, is like when it starts to affect your life, your functioning, your job, your mental health, and you're not sleeping, you're not doing your normal stuff.
Right. I think if you can think of it when it's intrusive, uncontrollable, and it's impacting your functioning, I think those are your key markers. And when you realize that you've been experiencing this, looking back, more often than not, this is how you're feeling, that's a pretty good indication too.
Cool. Mm-hmm. Now, so maybe I'm less anxious than I thought. Aha. I'm going up and down. It's a roller coaster for my
I mean, I'm not going to lie. When I looked through those markers, it was pretty glaring for me.
Some of them. Now, why, I guess, we kind of covered on like, why is there so much anxiety going around? But what about like health anxiety specifically? I feel like that's what I deal with more, is that many people come in and they are afraid that they have the worst case scenario. And while that's part of that's like a normal human emotion, like if you like you said, with the internet being available and hearing these, now the news of everyone in the world and every bit of medical information, some person got diagnosed with a rare tumor in like Nebraska, and you see it on your Facebook page or whatever it is, it kind of like brings those things up when they shouldn't, when maybe the one doctor in Nebraska has seen that case once in a lifetime. And now random people know about it. So it's like I don't know if that's the availability bias, whatever it's called, but like you're seeing something too often that is not represented, in reality normally with the numbers. So but everyone thinks that. So a lot of people come in to the office, and if I had to guess, are more people more like, oh, whatever, it's probably not going to be that. I mean, there's a lot of people who are reasonable like that. If they have some symptom, they don't automatically jump to the worst case scenario. But I have to say it's probably 50-50, where like 50% of people are telling me that they're the one in a million. They're going to be the one with the cancer. If it's going to happen to anyone, it's going to happen to them. I don't know if that's more just like doom and gloom, or if it's like some sort of general health anxiety. But I get this a lot, and it doesn't necessarily maybe go back to David's story here. But how do I deal with that? This everyone's worried about the worst possible scenario. So someone comes in with mild abdominal pain for 3 days, and typically, maybe it's a virus, maybe you ate some bad food, maybe you took too much aspirin. Like those are often the things it is. Often a virus. You have a little diarrhea, you have a little belly pain, you don't feel well, and people come in to see me, and I'm happy to see them. It's great. If they waited 3 more days, it might just go away. Right. But all of a sudden they're like, I need a CAT scan. I think I have cancer. It's definitely cancer. And they're like sweating, and like their heart rate's 120 in my office. And that's just like, you call them 3 days later with some blood test results, and they're like, oh, I'm fine now. Actually, everything's good. Right. It passed. It was a virus. But like, what's up with that? Because I see that a lot, and I don't know what that is. Like, is that just anxious people, or is that just like the amount of health information that's out there is just overwhelming, and everything's the worst case scenario? I don't know.
Right.
Help me.
Well, I mean, when you're anxious, it goes back to that irrational thinking, right? It's irrational. Your anxiety about what it could be is now increasing, which is now making your physical symptoms more prominent to you. And now it's just perpetuating that cycle of, well, now I really, like, my stomach's really hurting now, and this isn't something I felt before. And so once your mind's very powerful, right? It can really impact the physical symptoms that you're feeling. And so, like when people have panic attacks, they truly feel like they're having a heart attack because your body is really experiencing it that strongly. So I think when we spoke in the last episode, we talked about just like just them coming in to see you is anxiety producing for some, because we do have a tendency to think about those one in a million chances of something being wrong, and what if it really is. And I think probably everyone experiences that. Maybe some people it's in the back of their mind more of, could something come out of this? Maybe, I don't know, I'm sure not. But then you have other people who it really becomes the focus of it. And one of the hardest things is you don't want to make them feel like they shouldn't be there. You want to take everything very seriously, because I'm sure you've had situations where you didn't think something was going to be diagnosed, and then you do the testing and the imaging and you realize that it is something serious.
Oh, for sure.
And I think happens. That's, and I've seen, it comes up on your social media streams and all these, if you're experiencing these 7 symptoms, you may have cancer. And some of them are so general. There's some things that people probably experience every day. Just, we talk about as we get older and you wake up in the morning and you're like, well, everything kind of hurts. I feel like that's just normal when you talk to other people.
Right.
But how do you discern? How do you say what is something that should be followed up on? What are just hunches people have that they come in and they have that, I just have that feeling, and you want to, make them feel heard? And do they have a family history? I imagine some people who come in do have an extensive family history, and they really do have reasons for maybe feeling that.
Yeah, no, for sure. I mean, I think a lot of people who bring up the 1 in a million type bad situations, they have a personal experience with it. So I do get it. Like, it doesn't come from nowhere. But it's also hard to manage in the moment when I'm meeting someone for the first time. And I mean, my general approach, it depends on the story. I mean, we take a history, you listen to the objective symptoms. A lot of times I have to step back and like try to figure out like what's the objective symptom here and what is the anxiety type, like racing thought symptoms that they're having. Because, you ask about things like, are you losing weight? How long has this been going on for? What's the family history? There's a whole laundry list of questions that you look for to figure out like, maybe with, 80% certainty, is this something really bad, or is this probably going to be nothing major, some self-limited illness? And sometimes you get those, you get that story. Yes, I've lost 15 pounds since this started. And you're like, all right, this is not just anxiety. This is like, we have to keep digging until we find something, or until we've looked everywhere and found nothing. Like, there's certain times you have to do that.
Right.
But lots of people, it's the opposite. It's like, well, we could do a blood test so you'll feel better, like just so you'll feel like we did something. But I bet if I called you in 3 days and you just took it easy, and ate soup for a day or two and took some Tylenol, you'll be fine. And that's like often the case too. So part of that's just the medical.
And there's also, people who have extreme anxiety, it impacts their appetite, and they may have weight loss over a certain period of time.
This is true.
There is that, and then what are they, and I guess also from that medical piece too, are they taking any medications for their anxiety or some other, condition that might be creating those symptoms as well? Sure.
Or do they even recognize their anxiety? Like, are they even self-aware of it?
Right.
To like, sometimes I'll bring that up and say, well, like, here's what we're going to do. You're going to come back and follow up in a week or two. We're going to make sure nothing's wrong. We're going to do a blood test today. And like, people feel better. And is that because I treated their anxiety with like reassurance and a follow-up plan? Or is that because, I don't know, like, do they even know they're anxious?
So I think when people are experiencing anxiety, there are a few things you have to consider. So it's, okay, what am I feeling anxious about? And then thinking, is this something I can control? Is there something I can do about it? And then putting a plan into place. Like you just said, outlining, okay, so these are the steps we're going to take. We're going to do some blood work. We're going to do some imaging, and putting that kind of, plan in place for them, I think can give people peace of mind. Okay, I have a plan. I know what we're doing. I can work with that. When it's something that's not in their control, that's where that counseling piece comes in. That's where the coping skills come into place. Like, this is something you have no control over. You can control how you respond to it. So let's kind of figure out how we're going to do that while you're getting all the other information. And I think those are two important pieces to, when you're speaking with patients, and you might be doing it naturally anyway. I think it's whenever we're trying to help people and give advice, it's, okay, what can we do? What's the biggest impact right now for you? And how can we help address that? What specific plans can we put in place?
Yeah, it's about making a plan that the patient's happy with and that makes sense medically. And if you meet those criteria, usually you're okay, I think. And then, close follow-up. Just make sure that they're coming back to see you, because if something really bad's going on, it doesn't just like, it's not like you just have that one day to get it right and then otherwise the patient like
Yeah.
gets blasted off to the moon, you're never going to see them again. Like they're going to come, they should have to come back, and you see them in a week or two. And is it getting worse? Is it getting better? If it's getting worse, then you jump in and do some crazy tests. But if it's gone already,
I think that, and I think that follow-up piece is important too for the patient, because it in some way validates, right, that they're, I think everyone's afraid that they're, for lack of better words, going crazy. That you don't want someone to come and tell you it's all in your head. You just have to do this. And like you were saying before, calm down, don't think about it. I think when people have somebody who kind of can take those concerns seriously and really walk them through that process, I think that's going to be even probably a bigger help in decreasing those feelings than just what the results of that test may be.
For sure, right? Because the test is just a test, and it needs to be interpreted and all that jazz. So, in terms of like, I don't feel like I'm a super anxious person. Maybe I am in certain ways, but like, if I feel like I think of things in a rational, like step one, step two, like kind of like an algorithm, like if you're going to do this, then you're going to do that. And if that's yes, then this is the next test. And, we're going to go down the list of tests and questions until we kind of get to the answer, or until we prove that everything's okay. Some people don't like they don't get that, or it doesn't speak to them, or maybe it's not the right approach, I should say. So like, how do I communicate with people? I find that many people are like, it's almost like paralyzing the anxiety, and they can't, like, I'll say, hey, here's a decision, a simple thing, like, let's do that. We're going to do a blood test and a CAT scan, and we're going to see what the results are, and then we might have to do a colonoscopy or whatever that it is. It might be a medicine, it might be a colonoscopy, it might be wait a couple of weeks, it might be a different type of scan, but that's the plan. And some people just like are paralyzed. They don't even know, like, well, what do I do? I'm like, well, this is what we're going to do. We're going to do this thing. And but what do I do right now? And I'm like, well, you go to the lab and you get your blood done. Like what? Sometimes you end up in these like circular loops of like, I'm telling you just a simple thing, like do this one thing, and they're just like, but I don't know what to do. So you just keep talking about the same thing, and I can burn 15 minutes talking to someone about literally the same thing. And so clearly, like, they understand what I'm saying in terms of the English language. It's like, how do I better communicate with them to get them to like do the thing and feel like they're doing something active? I don't know if that even makes sense.
Well, I think, yes. And I do think while your simple plan that you just outlined in your mind is very linear, you may have lost them already at CAT scan. You said blood work, CAT scan, further imaging, then we'll follow up. And now they're thinking, okay, where am I going to get my blood work done? How am I going to get there if I don't have transportation? I have to work. Is that going to impact my work schedule? How am I going to get there? I have like kids. Who's going to watch my kids while I do that? Oh, and I think you said CAT scan, and that sounds really scary. And so in your mind, you are doing a typical consultation, and in their mind, they've just spun into 100 different places that you will never even be able to begin to, unravel. I mean, I know some people often come in with a family member or a friend, or, and I know you do encourage that, like to have another person in that room who can probably be their second set of ears, because if people are coming in already very anxious about what they're, coming to you for and the symptoms they're experiencing, then maybe having someone who can help them
for sure
understand that plan.
Yeah.
And I also think having it written down for them and something they can reference later when they're maybe at home and when they're able to kind of think about, because there are times, how many times have I come home to tell you something, you're like, well, what did they say? And I'm like, well, I think they said this and I think they said that, but I don't really remember, because, you're putting on your own, your interpretation is skewed a little bit by some of the other things you might be feeling emotionally. So
it's very true. And I think even the first thing you said, like how I'll say like, oh, you just do these two simple things, and that's like all of a sudden like a spiral of a million objects. And we do CAT scans all the time. Like we throw around these tests all the time, and this is just like, this is like, as a doctor, you order CAT scans all the time. Like, most of them come back and they're fine. But for that patient, that's like the one CAT scan they're getting maybe in 20 years of their life. And they hear CAT scan, they think cancer. And I can tell them with my words, like, hey, we're doing this to just make sure. It's peace of mind almost sometimes. Like, I'll just say, hey, we're doing that. I don't think anything's majorly wrong with you, but there's no way to really tell. Let's just do the scan. There's a 1% chance there's a problem. I almost say that, like, to reassure them that I'm not. Some people, they read too much into, like, your eyes and, like, what you're thinking. And, like, I just tell people what I'm thinking. I don't know. That's in my mind, like, just I'm telling you what I'm thinking. But that doesn't always translate. So
Right.
yeah, I need to like be able to get into the matrix of people's brains and just make them feel what I'm thinking, but that doesn't exist yet. One day. But that's a good point, because yes, I not just me, like every doctor, like, you have to move forward and do some tests and do some things. That's why you came to the doctor. So,
well, and look, there's you have to be realistic too, right? About the amount of time you physically have to spend with that person, the amount of patients you have to see, the procedures, like things that come up throughout the day, emergencies that come up. Like there are other factors. I think everyone kind of has to manage their expectations, right, about what can realistically come out of that consultation time.
No, absolutely.
And are there other resources and ways that you can help this person navigate those recommendations and that system that maybe aren't directly with you in the room at that time?
Right. Yeah, no, absolutely. The time is the biggest factor for everything, because it would be great if I can sit there and spend an hour talking to someone about the nuances of like why we're doing this and not that. But then you can't, because you go out of business and you can't see any patients if you're out of business. That's a bad business move.
And I think there's also an unrealistic expectation of what the patients have for the time you have with them, right, and the information you need from them. Like they don't necessarily need to go back to their history from when they were 12. That's actually the number I was like.
Yeah.
But sometimes people think that you want to, yes, if there's a consistent pattern or thing that have been happening with them for a very long time, that's information you would need to know. But it's not necessarily going, I think sometimes people think like certain maybe details,
yes,
that are more extraneous are going to be the key to the diagnosis, and that's not maybe always the case.
Rarely. I mean, sometimes, but rarely. And
or they forget to tell you the big thing.
Yeah, right. Like why they're there.
Like,
why am I here? They'll tell you that they picked up, they saw a doctor on, Main Street 23 years ago, and their friend Jimmy drove them, and Jimmy works as a banker, but he had to take off that day. And you're like, oh my God, where are we going with this? And right, they don't concentrate on like, why am I here? Oh, it's because I have blood in my stool. Like these, like sometimes it takes me 5 minutes to get the gist of like, why are you here? What do you need me to do for you?
Right.
And it's very challenging. So, right, time is always the limiting factor. And time is always the limiting factor for people listening to podcasts too, I think. So I think that, they run out of steam eventually listening to my blabbing. So I'm glad to have you here as a guest. But so my philosophy has always, for things that I know that I should do or have to do, I always just think like I'm going to get nervous or anxious about it, but I'm just going to do it anyway, because my rational part of my brain is going to just override the feeling of like, I don't want to do this. So this is why people, I feel like, do anything. Like, why do people, I don't know, get clothes on and brush their teeth in the morning? It's like, well, they don't, it'd be nice to sit in bed all day, but they feel I got to do this, but I'm going to do it anyway because I know that I have to do it. So for me, drinking colonoscopy prep, for example, it's gross. I've done it. It's disgusting. And you just do it. And, it's never really as bad as you think it is in your mind. But if you just think about it all day and you never do it, then like, if you don't feel the anxiety and the fear and just do it anyway, then you never get the procedure that might save your life. So that was my amateurish Instagram meme advice for this guy. But what, like,
I don't think
how
it's
do you,
amateurish. I think there are some people who respond to that,
yeah,
right? Like, just do it. Like, you have to, part of life. But I think for people who might be experiencing a little bit more anxiety than your typical person, that's not probably going to be received well or be very helpful.
So like, how do I coach people with, because again, I'm not a psychologist. They're not here for psychological counseling. This is just like, our after hours brainstorming session. But when someone comes in with a specific problem that relates exactly to what we need to do, for example, getting back to the topic, is like, I can't drink the colonoscopy prep, but I've never been screened, and I have a family history of colon cancer. It's really important I get screened. There's a good chance that we'll find something. If David has a colonoscopy, there's a good chance that his doctor will find something that might change his life, save his life, right, prevent a cancer, whatever. Or it could be normal, but you just don't know until you look. But how do we get him to the point where he can potentially do a prep? Right.
So I think it's what's negotiable, what's not, what's in your control, what's not in your control, right? So we know the procedure, not in your control. That seems like something that should really be done. The type of prep, right? We've talked about this before. They're drinking the prep. A lot of people seem to be very nervous about that. They've talked to people who have had that done before. They're worried about throwing up. They're worried about, are they able to get through it? And then, of course, all of the aftermath once the prep has actually been drank.
Right. We call it the fun part.
No. But, and then he also mentioned the pills. And I think, so for someone like David, like he's already actively in treatment. And like I said before, he's very self-aware of the issues that he's kind of dealing with. Beyond that clinical psychologist, it might be within his best interest, because you do have that pill option, which seems to probably be one of the lesser or one of the easier of the two forms of prep for him to engage in. So with a psychologist you're working on, maybe you're starting with small placebo pills. We use Tic Tacs with our kids when they were trying to learn how to take pills. So trying to start with something smaller and having him gradually work up to being able to swallow a pill that's the size of the prep pills. I don't really know in comparison what they look like.
They're decent. They're like the size of a multivitamin.
Okay.
Each one. And
So-
there's 24 of them.
So you do have so that is, right? That is a large volume to have to swallow. But I think that, that is at least one, that's like a plan, right? Like that's something that you can say, okay, I know this is my goal. I'm working towards swallowing that number of pills. Let me just start with one and see if I can handle swallowing a smaller pill, and then gradually working up. Because I think in David's case, he's not actively having symptoms, right? He's doing this more as I'm concerned I have family history. I have a very healthy lifestyle, but this is something that I want to do for myself. And so he has the time, right? If this was somebody who's coming in with active symptoms and bleeding and weight loss, and we don't have time to kind of build up to this, because it could take a little while. There are also specialists in the area of feeding and swallowing that outside of your practice, if he's working with a team of people already, that might be in their best interest to consult with as well, because that's also their area of expertise, and they might be able to work on the liquid prep too as well. Maybe there's a taste component, maybe there is some other piece of that we can kind of build on too.
Yeah, the hard one is this. He has this fear of vomiting. So even if he does the prep and say it was just like water, there was nothing. Like Miralax prep, super easy, tastes like water. Really anybody can do it if you put your mind to it. But people get this fear of vomiting, which I know is a very strong phobia for lots of people, and it really can affect them. Again, I feel like that's more, I can give anti-nausea medicines. I can give things that will stop the brain from telling the stomach to vomit as aggressively. So maybe that will help. But I don't know if that's the same pathway. I feel like that's a different pathway that's going to make you throw up, than just blunting the nausea response or the vomiting response. And
he's already had 4 unsuccessful attempts.
Yeah, so he's each one seems like it probably is harder.
I would imagine,
think, yeah, because it probably reinforces the previous attempt. So, and to touch on your other point too, this may sound, I don't know if this is okay to say, but Let me ask, is it okay to say? Yes, it's okay. No, but I think when stuff does get serious and people do know that there's a real serious problem, I've seen a lot of people who are afraid to do something, all of a sudden they're breaking the door down to get it done yesterday.
Yeah.
You see this a lot with the Cologuard test, actually, because people who do Cologuard testing, which is the stool-based screening test for colon cancer and colon polyps, the people who do that test, they're doing that because they don't want to do colonoscopy. So they're already self-selected out as a population of people who do not want to do colonoscopy. Either it's the prep or the anesthesia or the procedure itself, or they've heard a bad story, or it just sounds weird, or it's whatever it is. They don't want to do colonoscopy. So they do Cologuard testing. And the ones that come back positive, some of them just blow it off, which is just amazing to me. But you should definitely not do that. But the majority of them, now they're for someone who didn't want to be, 100 feet away from getting a colonoscopy, they're breaking the door down. Can you do it tomorrow? Can you do it yesterday? So all of a sudden their whole anxiety relationship to the procedure has completely changed, because now maybe the odds have changed. Do I really need this or not? So just I don't want to go skydiving. It just seems I don't know. It doesn't appeal to me. But I also would be nervous that I'd die by jumping off something. But maybe if I had a parachute and I was in a plane that was going down, I would be skydiving, because now the risk ratio, reward ratio has changed quite a bit. So, not saying that this is helpful for David, but you do see that phenomenon when people are super anxious about something, and then all of a sudden it's they want it now.
Right. So. Because maybe there is that piece, right in the back of your head, where you're that idea of this probably isn't serious. I know this is I'm probably going to be okay.
Yeah. And
then when you do get more information that kind of tests that theory, it definitely does, I think, spur people to action a little bit faster.
It does, yeah. And the shame is when you're not okay. And I recently had a patient in the practice who was diagnosed with colon cancer just recently, and she was avoiding colonoscopy because she had one in the past. She was not anxious patient. But she had a bad experience many years ago, 20 years ago, when I was, in college or whatever. College? High school? How old was I? College. Med school. But a long time ago, she had a bad experience with a colonoscopy. A doctor did something that didn't turn out great, and she never came back. And unfortunately, she went through 20 years, didn't get screened. She was one of the unlucky people that developed colon cancer. And I don't blame her for that. I just feel bad.
Right.
And I guess the point is, like, sometimes people do have things. So the screening is not, like you said, it's not a flaming emergency, but it's still important. And that's why I think the end of the day, the advice should be just get the Cologuard test and do something, because at least you'll know that.
Well, right. And I guess that's the other piece of it. Like, if you have other markers you can use, then that seems to be the answer, because in his situation, he really is seeming to be really utilizing a lot of these resources and trying to get to kind of the root of the problem.
Yeah. And then, I guess to wrap things up, I'm a medical doctor that does gastroenterology. How much psychology should I really be doing here? I feel like it's very helpful, because everything we do is psychology. Like, every time I talk to another person, it's psychology in some level. But at some point, I have to throw in the towel and say this is beyond my ability. And I feel like maybe I should throw in the towel a little earlier sometimes, because sometimes some people just need a nudge, and they just need me to say things a certain way, and it's great. But some people who, he has been seeing multiple mental health professionals, psychiatrists, psychologists, for, I think he said 2 decades.
Yes.
2 decades. How can I fix that in a GI visit? I can't. I mean, that's the bottom line. I just can't. So at what point should I cut my losses and just say, you know what, it's not even worth putting yourself through the anguish of doing this prep. Just do whatever you can, dude. Is that valid?
I think that's I think that has to be a personal and professional kind of decision. That, I think when you have seen enough patients who kind of present in similar ways, you kind of know where your advice is going to land, right? And you kind of know what you have control over as the recommending physician. We can't change people. They kind of have to be motivated to change for themselves. We can guide them. We can provide the resources. We can set them up in a position to make it easier for them to help themselves and to make themselves available to, participate in the recommendations. But at the end of the day, we can't force anyone to do anything that they are not willing to do and put themselves through.
It's very true. And I think my philosophy on that as I get older in practice has been changing in terms of maybe I was more idealistic or whatever it was, or I figured with more facts, people will come to the conclusion that's obviously the right conclusion. But that's obviously not true, especially nowadays. Yeah. So I think, yes, I'm here to guide, and I'm not here to force people to do things. And if I present the evidence as we know it in the current year, whatever the up-to-date science is, and people don't want to take the evidence, then I push a little bit, but I don't push as hard as I did maybe 5-10 years ago.
Right.
Because I feel like it's just I don't have time to talk to a wall.
It's almost more of a, you're engaging them in a conversation, and it's, I think, probably becoming less about, this is my recommendation, this is what we're doing, as opposed to, okay, this is kind of the gold standard, this is what we should be doing. I kind of understand your concerns, I hear what you're coming from, so we can talk about other options, but you just have to mitigate those expectations of what your outcomes might be. Colonoscopy is going to be your number one gold standard, right? We know when we do these procedures, we will find precancerous polyps, we will be able to actually remove anything that's in there, and that's going to be probably your best form of information. If it's so aversive to you to do this, then we can do these other things, but just know that they're not going to be as successful in finding those things. And so I think, which again, there's going to be negotiation. Patients are going to come in and say, I can't do that, I can do this, which as a physician I can imagine is very frustrating, because when you've seen what can happen and what can prevent and help someone, and they don't want to take advantage of that can be, hard, I think, to kind of in your own mind come to terms with.
It can. It's sometimes it depends on the situation, but sometimes it's more of I don't know if it's just I sometimes feel like here's the advice. I don't know. You can take it or leave it.
Mm-hmm.
It's like I have to detach sometimes and realize that it's not me.
Mm-hmm.
And like I'm not doing the right thing. I'm giving you the options. I'm giving you the knowledge, and there's many other places you can get information from. They're not all accurate, and that's what I have to offer.
And I think people also have to know that like you're not taking it personally, that they are not taking your advice. Like,
right.
It's okay. Like that's your decision. You're a patient. You're a full-grown human being who has autonomy and can make decisions.
Right.
This is what they've come to you for, and if they're not going to avail themselves of that, then
right, exactly.
That's okay.
And that's a shift. I wasn't always like that.
Yes.
I don't think anyone was. Like in the beginning, like when you come out of training and fellowship and everything, even the first like whatever many years of practice, I think you do. I mean, you definitely want to like help people get better or stay healthy or whatever it is. So like you definitely do try to give them like you try to like give them the information from 18 different angles. Mm-hmm. And
almost like you're trying to convince them. Like
you're
trying to
right.
like
You feel like you're trying to sell
your
them.
case almost.
Yeah. Like you're trying to like push them. You don't want to be pushy. I try. You respect their autonomy,
mm-hmm.
but sometimes it's just like enough is enough. Like, all right, I've told you like 7 different reasons why this is the right thing to do, and I didn't. I sometimes have to remind myself like I didn't break into your house and kidnap you into my office, and then you woke up on the table and were like, why am I here? And I'm telling you, get a colonoscopy. Like you called and made an appointment to come in to ask me a question about your GI tract, and here's my information I'm giving you from the training and the years of experience and the reading and the testing and all that stuff that we do, right? And like if you don't want to take the advice, like that's cool also. Like I'll come back when you do. Like that's kind of my attitude now. It's just it's still sometimes it's a little jarring because like here's the like you just do this thing and you're fine. Like no, I don't want to do it. Okay, sorry. Like and sometimes patients even like they act like I kidnapped them out of their house and brought them to the office. They're like sitting there like I'm not going to do that. And I'm just like, well, okay, like this is not like a contentious talk here. You came to me for like advice. Just like if I went to my accountant for advice, I wouldn't yell at him because he gave me advice that is probably in my best interest. I would. It's just I don't know. I guess we're getting off topic, but it's fun to talk about this stuff.
No, I mean, look, I think it's one of those things that it's like you want to have people have enough information to engage in a good conversation with you about it, but there's still a lot of training and a lot of education and experience that goes behind the things that you're saying, and I think people sometimes feel like they come in knowing as much as you do, or they know sometimes better than
they often know a lot more than I do.
And I think that can become like a power struggle almost.
It sometimes is a power struggle, right? Which when I feel that happening, I kind of disengage at this point, and I tell them like, okay, here are the medical guidelines. Here's the standard of care type stuff that we should do, and if you want to get your information or misinformation or propaganda from some internet rabbit hole, then like it's buyer beware, and you have to. At some point, you have to take some personal responsibility.
Right.
So that's that. Anyhow, any closing remarks that you'd like to share with us from a psychological perspective?
I think there are a lot of people who are probably listening to this and either thinking, oh my gosh, I definitely have clinical anxiety now and I need to go. But I think the take-home message really is that, there are certain things that, we kind of need to do for ourselves to keep ourselves healthy. Some of those things make us uncomfortable. It's okay to feel uncomfortable. It's okay to experience, some negative feelings sometimes. If you're experiencing these types of feelings towards your specific procedures or towards your specific results with your physician, like I think that's a conversation to have with your doctor and to, kind of maybe explore outside counseling if you feel like it's something that is really affecting your functioning as you kind of think through what some of the things that you personally have been dealing with, because sometimes it does require more than just what your medical doctor can do for you. And I think that's something that even people have a hard time admitting to themselves.
Absolutely. Well, it was a pleasure as always, and thank you for being my best guest. I'm trying to think. Are you my second guest? My first guest? No, you were my first guest.
No, I was your first.
And then I had another guest. Now you're my third guest, but it's a repeating affair, so that's good. So hopefully you'll be able to do some more of these.
I have to say, this is a much, this operation's really like growing.
It's stepping
from the
up.
last time I was here, from the first time we did this is.
Last time, do you remember that with the microphone that we used for I had this one microphone for myself, and I didn't think I'd have any guests or whatever it was. Do you remember whose microphone we used?
No, I don't think.
We borrowed our son's microphone that he sings into. Right. So you were talking through like a studio vocal mic. It was a decent one. It sounded okay.
Got the job done.
But the levels were off, so now everything should be good levels. I don't have to adjust the audio too much.
No, this was fun.
So it's pretty cool.
It's always nice to chat.
It is nice to chat. This is sometimes the most I see you.
I know.
In a week of doing charting and running around with children's driving responsibilities, right?
I know. Whenever we do these things, I always think of your grandfather.
Right.
Mind and body.
Mind and body. This is the mind and body experience you're getting today. Well, if you enjoyed this show, please take a moment to follow the show on your favorite podcast platform. Apple's a good one. Spotify's a decent one. And there's a million other ones out there. And the best thing you can do actually is just share it with a friend. And you'll share it with your friends, obviously. So we'll have 1 million followers by next weekend. I should also make a plug that March is Colorectal Cancer Awareness Month. And I don't really have any colon cancer awareness podcasts pending for this month because I've basically for the past 2 months, all I've been doing is talking about colon cancer and polyps and preps and stuff like that. So people are probably sick of it. So that information is still out there. Obviously, it's still true. But just make sure if you haven't been screened, if you're over the age of 45, no family history, no symptoms, and you're a man or a woman, just get screened because it's the best you can do to prevent colon cancer. It's ultimately a very preventable cancer if you are of a certain age. Now, when you're under the age of 45, you may have a reason to get screened because you might have a family history of polyps or cancer, or you might have symptoms, and that's not really screening anymore. But if you have concerning symptoms, if you're worried, if you're a young person with rectal bleeding, change in bowel habits, abdominal pain, or some other symptom that you might be concerned with, you have to be your best advocate because colorectal cancer is rising in young people, and the diagnosis is often delayed because the symptoms don't always make sense with what we expect from a 30-year-old. So every once in a while you see a young person with colon cancer, and it's very scary. So make sure that if you're over 45, you get screened. Make sure if you're less than 45, you ask your doctor if you're concerned about any symptoms. And that goes for the entire year, not just March, but March is the time I can plug Colorectal Cancer Awareness Month. And that is all I have to say. So thank you again, Dr. Noreen Vail, for your expertise in psychology. And also thank you for being the best wife and mother.
Well, thank you for having me.
Anytime. All right. Take care. I hope you enjoyed listening to this episode of The Real GI Doc Show. Please subscribe to the show on Apple Podcasts or your favorite podcast player to catch my next episode. If you really want to show your appreciation for the show, take a moment to rate and review the show on Apple Podcasts. It only takes a few seconds and is the best way to get other people to discover the show. If you use social media, you can find me under the handle @RealGIDoc, so feel free to follow, leave a comment, or just say hi. If you have a question about something gastro-related that you'd like me to answer on an upcoming episode, go to realgidoc.com or use the link in the show notes to leave me an audio question.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.